Shingles, What It Is and How to Prevent It by Beth Pratt. What is shingles? Also known as herpes zoster, shingles is a viral infection that typically causes a painful, blistered rash. Usually, it affects older adults or people with weakened immune systems. It tends to appear on one side of the body or face, lasting for 10 days to 4 weeks. Potentially, shingles can become a chronic, sometimes debilitating pain that lingers long after the rash has cleared. Less common still is a condition that affects the eye, seen on up to 25% of cases, that may result in prolonged pain, scarring, and in very rare cases, vision loss. Symptoms of shingles. The early symptoms of shingles are itching, burning, upset stomach, and tingling with pain before the rash develops, which lasts for the duration of the rash. Shingles infection is identifiable by the way it looks and feels to the patient. For several days before the rash appears, the patient is likely to experience these sensations. It is common that the rash appear in a single stripe along a nerve path on one side of the body or face. The rash is painful, made up of raised blisters. Usually, the rash appears on the torso, arms, thighs, or head, including around eyes and ears. Though the most common rash location is the chest or abdomen, patients describe the pain as aching, burning, stabbing, or shock-like. Complications from shingles. If contracted, shingles can cause long-term complications. 10% to 18% of patients will experience long-term nerve pain called post-herpetic neuralgia, PHN, after a shingles infection. The pain from PHN can be debilitating. In patients under 40 years of age, this is a very rare complication. Pneumonia, hearing problems, brain inflammation, encephalitis, or even death can occur, but are exceedingly rare, usually impacting only those with the most severely weakened immune systems. Vision loss is also a potential complication should the shingles rash be on or near the eyes. Causes of shingles. Shingles are caused by the same virus that causes chickenpox, scientific name varicella zoster virus. After chickenpox infection, the virus remains in the body, though dormant, but it can activate later in life. Approximately 99% of adults over the age of 50 in the United States are infected with this virus. The scientific community does not have a definitive answer as to why the virus reactivates to cause shingles in later life, though it seems that there are multiple factors. Primarily, it seems that age is the culprit. As we age, our immune system weakens and allows for the reactivation of the virus. Stress may have a part in this as well, but age is still the leading indicator of risk. You cannot get shingles from someone who has shingles unless you have never had chickenpox nor been immunized against it. During the period when the shingles blisters are fresh and have the potential to ooze fluid, a person without chickenpox immunity may contract the disease by coming in contact with the blister fluid. Once the blisters have developed a crust, the virus can no longer spread. Shingles treatment. If you develop shingles, there are a variety of treatments used to combat the symptoms of the disease. Antiviral medications like acyclovir, valacyclovir, and famciclovir are used to shorten the duration and lessen the severity of the illness. These medications are most effective when taken as soon as possible after the rash appears. Pain medicine, either over the counter or by prescription, may help relieve pain caused by shingles. Wet compresses, calamine lotion, and colloidal oatmeal baths may help with the itching. Shingles prevention. If you are of a generation who were children before the chickenpox vaccine was developed, you likely fall into the 99% of people over 50 who have the virus lying dormant in their bodies. Thankfully, there are vaccines available to prevent the reactivation of the virus. If you have had a shingles vaccine between 2006 and 2017, you may have received a vaccine called Zostavax. The CDC discontinued the use of this vaccine on November 18th, 2020. Since 2017, the CDC has recommended the vaccine Shingrix for adults over 50, with Shingrix becoming the only approved vaccine in 2018. If you have already had shingles, received a Zostavax vaccine, or received the varicella vaccine, it is recommended that you receive this vaccine. You do not need to recall whether you had chickenpox during your lifetime. Shingrix is used in the United States for patients over the age of 50. It is a vaccine that is given in 2 doses, 2 to 6 months apart. The data shows that it is 90% effective in preventing reactivation of the herpes zoster virus. For those under the age of 50, there are a number of qualifying factors, including a variety of reasons that you may have a weakened immune system. Your medical provider can help you determine whether you qualify for the vaccine. There are possible side effects to this vaccine. They include redness, mild to moderate pain, or swelling at the injection site. Less likely to occur are things like feeling tired, muscle pain, headache, shivering, fever, stomach pain, or nausea. Because this is a 2-dose vaccine, you may experience any of these side effects with either or both doses. Very rarely, Guillain-Barré symptom, a serious nervous system disorder, has been reported after a Shingrix vaccine. Should you have an allergic reaction, found to occur in less than 1 million per million doses administered, contact your physician for guidance. Medicare Part D provides coverage for this vaccine depending on your plan. For private insurance or Medicaid, check with your plan details or administrator to see what coverage you have for this vaccine. Sites for further information include www.cdc.gov, the Mayo Clinic's website at www.mayoclinic.org, or GSK at www.whatisshingles.com. 5 things you need to know about shingles. Anyone who has recovered from chickenpox, including children, can get shingles. Symptoms of shingles include burning or shooting pain, tingling or itching, chills, fever, headache, upset stomach, and rashes or blisters. Medications may help. If you are over 50, talk to your doctor about getting a shingles vaccine. While not contagious, someone with an active outbreak can spread it while it is in the blister phase. Keep it covered. Shingles last 3 to 5 weeks, and while not normal, it can return. Visit www.nia.nih.gov to learn more about shingles. This article was prepared by Beth Pratt, Executive Director of the Esquimalt Valley Chamber of Commerce.